Hi, my name is Erica Alexander and I'm one of the faculty here at Blessing Riemann College of Nursing and Health Sciences. Today I'm going to show you how to suction a patient via tracheostomy. First thing you need to do is gather your supplies. You will need some saline and a suction kit, and you'll need to make sure you have suction set up in the room. After you have your supplies, you will do your hand hygiene and perform your AIDIT. So the first thing you're going to do to prepare your supplies is to open up your suction kit. You're just going to take the top off of it, and you'll see inside it has a catheter and a set of sterile gloves. So you're going to carefully pick up the sterile gloves without touching inside of the kit and set those off to the side. Then you can go ahead and open up your normal saline and pour that into the container. And you just need enough. The purpose of this is going to be to provide a little bit of lubrication to the catheter, and it's also to check your suction and to clean the catheter after you've suctioned and to clean the suction tubing. So once you've done that, you're ready to put on your sterile gloves. So now you're ready to apply your sterile gloves. I'm just going to kind of push stuff out to the side. Sometimes these gloves are packed really tight in this package, so it's always a good idea to bring an extra pair with you just in case you're not able to find the cuffs or you accidentally contaminate these while you're getting them on. Remember to only touch on these flaps here, so that way if it closes like that, it won't contaminate. Then it's a matter of putting them on like any other pair of sterile gloves, pinching the cuff to start with. And you can see I kind of have my fingers messed up in this one a little bit, but that's okay. I can fix that in a minute. Then pulling that one on, and that one kind of did the same thing, but I can just fix those, not a big deal. Then I'm going to get the suction catheter in my hand. Since I have my sterile gloves on, I can touch it however I need to. How I like to hold it, just make sure it doesn't touch your arm down here. I believe that just touched my arm just a little bit, so I would need to start over again. So just be mindful when you're doing that, that this doesn't happen. If that happens, where the catheter is rubbing your arm, you would have to start over. So we'll say that I have a new catheter. And you want to kind of wrap that up in your hand, however you want to, that feels comfortable to you. What I usually do is I make sure that it's in my dominant hand, and I make sure that I'm able to, with my index finger and thumb, get a good handle on where the suction will connect, so that way I have enough pressure, I can get a good enough hold to connect the two. So then I will go ahead and get my suction and connect that. Now your non-dominant hand is going to become your dirty hand, and that can stay here on the suction tubing and right here, but it should not go up any further than that, and then you would use your sterile hand to suction. I would test the suction by putting it into the container with the saline and then applying my thumb to the little hole here that will create the suction, and then I'll be able to make sure that it's working. And then you can take your finger off of that, your thumb, and get the end of that a little bit wet. It'll make it a little bit easier to insert. You don't want it, dripping crazy wet, just so that way it's been in there and it's not completely dry going in. Now you're ready to suction your patient. So you're going to make sure that your thumb is not on the suction regulator, because you only want to apply suction when you're withdrawing the catheter and not when you're inserting it, and that's to minimize oxygen loss. So you're going to insert the catheter, making sure that you go directly into the trach and you don't touch anything. And your patient may start to cough, and that's when you're ready to stop, and you can start to pull back and suction. If you meet a little resistance, that means you're at the carina, and what you want to do is you want to pull back just a touch before you start to apply the suction. Then you're going to apply the suction while you're withdrawing the catheter in a circular motion, no more than 10 seconds. The maximum amount of 10 seconds is so that way you can minimize oxygen loss as well. So then I would go ahead, I'm going to come over here to my saline, and I'm going to apply the suction. That's going to help relubricate the catheter. It's also going to clean out the catheter as well as the suction tubing. Give your patient a couple minutes and see if they need suctioned again. If they need suctioned again, then again, we're gonna only suction on our way out. So my thumb is off. I'm going to insert it till they cough or I meet a little resistance, pull back, apply the suction, and come out for a maximum of 10 seconds. Then you're going to clean that suction catheter out again, even if it's your last time because you want to get all the suction tubing cleaned. And if it is your last time, then you can disconnect this and throw away the catheter itself. There are a couple other things to consider when suctioning the patient. If your patient is receiving oxygen, you may want to increase that oxygen up to 100% oxygen for a few minutes before suctioning, in between each suction pass that you make, and for a couple minutes after suctioning to help with that oxygen loss that they may experience during the suctioning process. If your patient is on a ventilator, there's typically a button on the ventilator that you can push that will say hyperoxygenate or something similar to that effect, and it will increase the oxygen for you and it will automatically take it back down as well. So just keep that in mind when you're suctioning a patient. You always want to be mindful of their respiratory status and make sure they are tolerating the suctioning well. And that is how to suction a patient via a tracheostomy. Thank you for your time.